for the invitation to speak here today. Connections are integral in the type of things that we do in my group. So my group is focused on contaminants that arise from the extractive industries. And we tackle this issue by scrutinizing and integrating data in a number of ways. We study humans as well as fish and wildlife. And as a toxicologist, I've been trained to look at toxic mechanisms at the level of the cell and try to connect these adverse health outcomes to the individual and ultimately ecosystem. My group mainly spans work that includes ecotoxicology, so again, looking at ecosystem health, but also human health. And again, connections and connecting are vital to the success of our group's mission. So what I'm going to do today is to talk about and share some experiences with our work with artisanal small-scale gold mining in Ghana. So for those of you who don't know, Ghana and that entire West African region is affectionately known as the Gold Coast because for more than 1,000 years, gold has been mined in that region. In fact, nowadays, a lot of this gold is being mined in a rather informal setting by artisanal small-scale gold miners. And the gold that they produce accounts for upwards of a quarter of Ghana's gold production, substantial amounts of money involved in the industry. Many, many people are active in the industry in Ghana, but also worldwide. If we think about the rising price of gold, and if we think about the tremendous poverty that exists in a number of LMICs, low middle income countries, there are more than 100 million people that live in communities around the world in which gold mining is occurring in these small-scale communities. And these communities suffer from a number of challenges to health, environment, and society. So I was initially drawn into this because of this notion of amalgamation. To get the gold out of the rock, it eventually needs to undergo standard mining processes, and then you use toxic mercury to amalgamate that gold, to then pull the gold out from the ore. That mercury is then burned off, resulting in tremendous exposures to workers and the ecosystem. So we've known for a long, long time that there's copious amounts of mercury being used in the process. And over time, we've learned that there exist a number of other challenges to health and the environment. So as a world, as a community, we have capacity and we have knowledge. But what's become quite apparent is that gaps exist across disciplines, thinkings, and methods. So what I'll do is I'll share with you some of the experiences we've had from Ghana. So early on, when we were invited to address this issue in Ghana, we convened a group of researchers across disciplines to have discussions. And following the discussion, we decided to go visit one of the small-scale gold mining sites that we've been working at for the last 7 years in a part of northern Ghana that's quite remote. So we took the group there, and immediately once we arrived there, what was happening is that amalgamation was happening right before our eyes. So what we have here is a miner who's using his fingers to mix mercury with gold, and in the process of that, what's going to happen is that he's going to burn the mercury off to get the gold pellet, and that mercury is going to be vaporized into the air, resulting in tremendous exposures to people. So we arrived there, our team of 12 researchers were witnessing this firsthand. I'm standing there, and then I look over my shoulders and realize my entire team has disappeared. I brought a multidisciplinary team here, and me with my narrow world view of this issue is just fixated on mercury. This is what drew me here. I look around my shoulder and I see Professor Tom Robbins, who's in the audience here in the middle with the hat on. He's an occupational physician, and he ventured right over to these workers who are using heavy machinery in rather unsafe conditions to crush the ore. Okay? Right around the corner goes Elizabeth Coomson, who is a Ghanaian PhD student in social sciences, and she's meeting some women who are doing the exact same thing that the men are doing, but they don't have the heavy machinery. They're doing this manually with their hands. And if you look closely at the woman in the green neon shirt, she's got her baby with her. So contrast these two images, the men using heavy machinery with the women doing this manually by hand, and I think it sort of epitomizes some of the contrast that exists in these communities and the gender disparities. They're not the only ones that disappeared from me. We brought a group of epidemiologists who are interested in issues of water safety. And here we have Kaylee looking at pools of water. There are many, many pools of water around, and she was starting to really get interested in questions of these pools being perhaps pools for vector-borne diseases, mosquitoes, malaria, so on and so forth. A chemist on the group looked at another pool of water, which is essentially mine pit water. And what the lady here is doing is she's using that mine pit water, likely for cooking. She may be using it to wash her clothes. They might be using it to create an alcoholic beverage which is consumed in the community. And what we were able to do is getting the chemists, working with the anthropologists, we were able to figure out how much does water actually cost, because water does have value. Water does have value, it's being used throughout the community, and we were able to actually show that this water has toxic and ultra-high levels of arsenic, chromium, and lead. And again, this water is mine pit water, which is being reused for a number of purposes in the community. Perhaps the smartest in the group are these two. Rachel is on the left, she's my project manager. Moshka is a doctoral student on my right. And they've been working in this community for 4 or 5 years, going every summer, and they've formed relationships. Because this really is a human issue. It's an issue of people and lives being affected. So over the years, they've formed relationships with people. Again, for every one worker in these communities, largely one male worker, there are upwards of 10 others that live in the community, women and children. And if you look at the literature on small-scale gold mining, most of it is focused towards public health issues around the workers, and we know much, much less about the women and the children. Us and others in recent years have started to show that these women and children, people that live in these communities, again, 10 of them for every one person that's an official miner, they're exposed to the same things. It's not surprising whatsoever. This is a community we've been visiting many, many years, and over time, this stack in the middle has been getting bigger and bigger. So you can see a stack in the middle. This is a small-scale mining operation. But what's happened in this case is the land concession owners, Ghanaians, have leased or rented the land out to a multinational company to come in and use their lands. So essentially the small-scale miners are serving as prospectors and renting or selling their lands to international bodies to come in. And the unique twist to this, which is not that surprising here in Canada, is that the miners are from China, but their operation is based in Vancouver, Canada. And I think these are stories we hear about a lot here in Canada. And my co-principal investigator in all of this is an anthropologist who invited me 8 years ago, Professor Alicia Rennie. Here she is doing what she does best, speaking with traditional leaders. And in this case, what we learned very early on in the process is that mercury, for centuries, in this community and many other places across West Africa, is viewed in a spiritual lens. It wards off spirits. People will buy mercury, impregnate it into the foundation of their houses to ward off spirits. Me as a toxicologist who came into this story concerned with mercury was befuddled by this, but again, working in an interdisciplinary environment really shaped my view of the situation. And in fact, if I think about back to this day, which was I suppose 7 or 8 years ago, it really was one of those days when my worldview changed. A toxicologist focused on mercury. I came here to study amalgamation. My team left me because there's so many other issues there, and I really started to wonder, well, if we get rid of mercury in these communities, how much of an impact are we going to have to help? Mercury is important. Yes, there will be some people benefiting from the loss of mercury, but there are all these other issues which are independent of mercury. And again, by coming with a multidisciplinary team, this became apparent to me. Put me in a very uncomfortable place, wondering what's my position here, but in many ways it's also quite liberating too, that it made me realize that there's more to this research story and I can have a greater impact, perhaps doing other things. So with that being said, we decided to venture forth on this issue, but use what's known as an integrated assessment framework. An integrated assessment is a framework that brings together the knowledge of ecosystems, people, and policy in order to find solutions for particularly challenging problems. Basically what the integrated assessment framework is telling us is that natural scientists and policymakers, they're disconnected from people, that policymakers and social scientists are disconnected from the ecosystem, and that social scientists and natural scientists are disconnected from decisions. So we need to bring all these parties together and have rigorous debate and discussion. And that's what we did. So the project started in 2008, but the formal integrated assessment started in 2011, 2012. We've had 5 rather large meetings over the last few years. What we've done is we've put together 4 discipline-specific work groups, so a natural sciences team, a human health team, a sociology team, and an economics team. We made sure that one co-leader was from Ghana, and one co-leader was from the University of Michigan, where I used to be a professor of public health, and that each team had quite a few Ghanaian members and an international advisor. In the end, what we were able to do is to connect 40 Ghanaians with 15 agencies. We're doing the things that scientists usually do, that we writing papers and presenting at conferences. We also felt it very important that we come up with evidence-based response options to then feed into decision-making, which I'll talk about in a moment. I would say what perhaps one of the greatest outcomes of this is that people were being connected either physically, their ideas were being connected, and the knowledge were being linked too. Again, in Ghana, there are many people that have been studying this issue of mining for a long, long time. However, surprisingly, very few of them have met each other. But by bringing them together, what we've started to see is that there is some interrelations forming, and that Ghanaians are coming together to address this issue themselves. Also, what we're finding is that groups are coming together to tackle other issues. So some of the members of the mining group have gone on to do issues or study issues related to electronic waste, as an example. So again, we felt it was important to ensure that the research outputs were translated into options which could be used by decision makers. So we use the Delphi method. Some of you might be familiar with this. It's an iterative method of trawling opinion amongst experts, really relying upon many, many surveys and polls. Just as an example of how we implemented this, we used an online SurveyMonkey poll. In addition to sticky exercises and also paper type polls, we looked at this evidence that we collected from the integrated assessment. We then came up with options, and then we asked the delegation to vote on these options in terms of their impact to the economy, impact on society, impact on the environment, but also their feasibility. Something may have a tremendous impact, but if it's not feasible, is it actually that useful? So we addressed feasibility in terms of economic costs, the acceptance amongst the population, will of politicians, and logistics. We got rid of neutral options because we wanted to force people to have this debate. And in the end, what happened is that 4 transdisciplinary recommendations rose to the top. I would say that no group alone would have listed these. If you look at the detail of these recommendations, they really did span all the various groups that were involved in the process. And by doing an iterative poll, we were really zeroing in on options that were grounded in evidence, but also considering various disciplines. We're at a phase now in which we're trying to take these response options to work with our Ghanaian colleagues to influence and address national and international policy. For those of you that study mercury, last year was an exciting period for mercury around the world because the world finally came together in a time when we can't agree on much and put into force a Minamata Convention on mercury. There's an annex in that convention which is focused specifically on artisanal small-scale gold mining. Yes, this is focused on mercury, but there are good things in that annex which will take or help alleviate some of the other public health issues in these mining communities. And at a national level, the Ghanaian government, for example, and the president has formed an interministerial task force. There are various other agencies in Ghana which are actively trying to address this issue. So we're trying to ensure that the evidence and the outputs of our projects are being fed into policy. I want to shift gears and really, I've talked about research, but another strong element of our team is research training. And I need to thank Tom Robbins, who's here in the audience for this, because he's the one that introduced me to the NIH Fogarty world and how Fogarty has funded a number of initiatives for Tom doing work in South Africa for many years and us as a group recently in West Africa, in which we're really trying to strengthen capacity in low and middle income countries through a program of global health research training characterized by innovations and training methods. And in the end, we want to increase capacity in the region, help create communities of emerging scholars, and ultimately stem brain drain. So what I'll do quickly is just walk you through a little network analysis, and this is not scientific, but I tried to think about the work we've been doing in Ghana in terms of mining over the years. So when we were brought into this in 2008, it was really a project that was led by North scientists with North trainees with some input from Ghanaian scientists. In 2009, we had more input from Ghanaian scientists. After that, the Ghanaian scientists and the North scientists started to interact more in 2010. Ghanaian researchers and students were being involved. With Fogarty support, we were able to launch a postdoc program in 2011 and get the postdocs working more on this project and trying to create this community amongst mid-career professionals. And then in 2012, things really took off where we started to see the balance of power shift from the North and sort of our initial ideas to getting enough resources into country so that the Ghanaian scientists and their students with some input from us could really start to sort of take over this project. What we've done in recent years is to implement joint training projects and pick projects that lend themselves to interdisciplinary teamwork so that we can bring together diverse peoples. What we've done is to place a strong emphasis on mentorship between the Ghanaian scientists and their postdoc, and by doing that, what we've done is we brought the Ghanaian mentor to the United States, give them protected time, help them develop deeper relationships with the US-based researcher or the US-based postdoc and the Ghanaian postdoc. And in the end, what's going on here, I think, is we're seeing less of a vertical relationship where we have the North driving and sort of controlling the work to it being more distributed and equally spread amongst the partners in the LMIC, in this case in Ghana. And with a strong, stable foundation and support through NIH and other groups, what we're able to do is to spin this off. And again, as I mentioned before, there are now groups doing e-waste under this rubric, and also issues of urban and air pollution. So I've run out of time, and I'm just going to end up with this slide. This is not that much different from what we've heard before, but in the end, what we've been able to do is to bring together good people, the will, and the ideas, bring people, have faith in the system, trust each other, have a lot of meetings, and over time the connections will happen to a point where we have a sustainable group of researchers in the LMIC and also in our country. Resources such as time and money are always going to be required to do this type of work, and again, we have this belief that we need to really focus on the space in between, and I think that's one of the major themes of the conference here. I myself, by adopting the eco-health framework, saw the world in a different way with that Mercury example, and ultimately this is one way to achieve this idea of sustainability. And I see Margot telling me that I'm done. So I'm going to thank many people, because again, this is based on teams and there are a lot of people to thank. And I do want to take one moment to thank one person in the audience, that's Laurie Chan, because we've heard a lot about eco-health coming together 10 years ago, and back then I was a PhD student here at McGill, and it was Laurie that introduced me to eco-health thinking, and I've come full circle back to Montreal, so thank you.